Share.
Just a minute. Simple video, Pankaj. Don't worry. It's like a easy game for you.
Yeah, yeah. For anyone
Everything is
who
simple
not
for you.
senior to me.
And I know everything is simple for you. You again started saying it.
Let
This
us
is
see
very
what.
simple. Depressing me again. Can you see? Hello?
Yes, I can see. Yeah,
I know, it's okay. I know. It's okay. It's okay. It's okay.
yeah. So who
You
I
want to
will
play again?
describe
You want
or
to play again?
no? No, it's okay. Who you want me to describe?
Yes, yes. You
Okay.
are a candidate now.
Yeah, I can see a young child who is crying a lot, and during crying he is holding his breath, and I could not notice whether any perioral cyanosis was there,
You have to notice.
but the
I'll play
picture
again.
video is not so clear.
I'll
No
play.
sinuses. Go ahead. Go ahead. No
No sinuses.
sinuses.
Sit up.
Okay. So I
I know, it's okay.
yes, so I could see a young child who is crying, and in between he was stopping his breath, and the person who is standing beside him was counseling him and holding her back. Yes,
Okay.
and I didn't see any other things like he. I think mostly at the home, not in the hospital setting, or
Okay.
maybe the clinic.
So, what is your diagnosis?
My most differential diagnosis is breath holding spells. First diagnosis, differential diagnosis. Second maybe a seizure attack, but this is least likely.
Okay. Any other differential you can think of?
Uh, seizure activity, I don't think so.
Can it be a cyanotic
That's all.
spell?
Cyanotic spell, but I didn't notice cyanosis or the tongue or the
If you don't
or
notice
the,
cyanotic
around the
spell,
lips. Then it may be cyanotic heart disease, maybe one of the diagnosis. But he was crying, so during cry only, if it is happening, then it is not cyanotic. Without cry also, there should be cyanosis.
okay. So, what history you would like to ask from mother?
I would like to take since when it is, since duration of this, and is there any congenital condition he was having or not, or any treatment going on. She is giving some supplements like iron tonic. She is giving, or she has been to any doctor for the same condition. Means diagnosis already made or not.
Mhm. So, what advice you will
Mhm.
give to the mother if you think this is breath holding spell? So what advice you will give to the parents?
Yes. Yeah, so first I will reassure them that this is in almost all cases this is normal and usually go by 5 or 6 years of age, and we will give some supplement if it's not taking like iron, which sometimes help. And during this episode, don't get panic and just reassure and calm the child. And if anything is in his mouth or which can be aspire, means can go inside the so this. breathing tube, or so we must be careful. We need to remove that anything around the mouth. Okay, and the child should be in a calm. If there is a light or any strong lights, so then we have to remove that sources which will provoke his this. And secondly, we should be careful that we should not make the child cry all time, because this condition is mainly because of anger or frustration in the child.
Okay. Okay. So, any investigations required in breath holding spells?
No, reassurance is the only treatment. If we exclude clinically all the other factors, then if our diagnosis is breath holding spell, then I would say reassurance. No need of any investigation.
Okay. So, if the breath holding spells are very frequent, would you not investigate?
Yeah, if it is so frequent, then we can do one. We can rule out the seizures, which is was first differential diagnosis. So we can think of doing EEG for the child.
Okay. Okay. Then, what is the prognosis usually?
Prognosis is very excellent. Usually, such episodes disappear by 5 or 6 years of age.
Okay. Okay. My questions finished. Anyone want to ask any question?
What is the role of ECG, Pankaj?
Sorry,
Can-
EEG and ECG also we can do. EEG first diagnosis. I mean to rule out the seizures. Sometimes if we feel that this is anoxic seizures, sometimes it can mimic anoxic seizure also. So in that case, we can do ECG.
How would you
If
differentiate
we are
and breathing hold spells clinically, apart from investigation, other than investigation?
yes.
Hmm.
Yeah, anoxic seizures are for few seconds, and if we provoke or something stimulator, like we have beaten them, for example, some stimulation, like we have scolded him or some physical stimulation. At that time, anoxic seizures happen, and this is usually around 1 to 2 years of age. Anoxic seizures, and that also doesn't require any treatment. We just need to do ECG and EEG. Means you all rule out heart conditions and EEG for the seizures.
A child falls on the ground, no?
That time also anoxic seizure. I mean physical stimulation while playing. Suppose the child got hurt, that time he will have anoxic seizures.
Okay.
Okay.
So what additional history you will ask?
Within breath holding spells, or in this case,
In this case,
additional history. Is there any family history of similar episode, or any drug history, any medicines he is taking, other medicines?
and what physical examination additional you
I
would
would
like to
like
do?
to a neurological and cardiovascular examination mainly. Rule out,
Anything specifically you would like to see on general physical examination?
cyanosis, if there is a central cyanosis like tongue bleeds blue or lips are blue.
You have answered for
There
that
is
already.
no, there is no cyanosis.
Anemia.
Anemia, yeah,
Anemia,
excellent.
Sorry, sir, we
Excellent.
answered for that already.
Yeah.
but pylori is associated with this breath holding, or
Anoxic.
What they say,
Anoxic.
like investigation, like usually no diagnostic investigation required, but you can do CBC to diagnose anemia, and you can start iron if child is anemic. Not all breath holding children will require iron. Secondly, treatment, like no specific treatment, but there are some do's and don'ts. Like when child gets breath holding spell, be calm. Don't reinforce the negative behavior of the child. Don't splash water on the child's face. As you rightly said, remove anything in the mouth, and don't shake the child, and remove anything which can hurt the child around the child, like some toys or any sharp object, like that. Try and avoid the behaviors which will anger the child. Yeah, most of the things you mentioned rightly. Pankaj,
but I have question. Means I am not sure if we give this iron syrup only if there is a pallor, or prophylactically. I think prophylactically we can give even if the hemoglobin is normal in breath holding spells.
NHS leaflets mentions that like if child is anemic, then give.
Otherwise, no.
Prophylactic no role. Only this also has a like association they found like if you give it improves the outcome. That is the only mention in the literature. Otherwise, not the documented role of the iron. But this anoxic reflexy, this spell, no, there you will notice what child will look pale.
Yes, pallor. Why? Yeah, well, he will become pale during the episode.
Yeah.
Yes, that is very important point to mention. Yes, I forgot to mention. Correct.
That is because of drop in heart rate. Because
Yes.
of sudden increase in vagal tone.
One question was asked by someone that will you do cardiac investigation, or when you will do cardiac investigation for this child? So what was the answer?
If I suspect anoxic seizures, then I will do to rule out.
Why?
Like
So sometimes the conduction defects are
what
mimicking.
What they mentioned is the breath holding spells are very frequent. You need to rule out the arrhythmias. That's why ECG is required.
Yeah. Any two? There are 2 or 3 indications. Too frequent breath holding spells, very prolonged breath holding spells, or as Dr. Pankaj said, associated with the reflex anoxic seizures, frequent seizures, not only once. Then you can rule out cardiac problem.
Yes.
Okay.
So we can wind up now.
Can we give any oral drug in case of this palate type? Is there any drug?
No recent drug discovered. Let us know.
Or injectable drug?
Already he is scared of the things. Means if he will cry, then episodes will again happen. So better to avoid injections. So
No, treatment.
Do you know any recent drug development? I don't think.
I think there is a drug mentioned frequently, atropine. They usually give this in palate type, atropine.
Where it is mentioned, which literature, we will also check.
Actually, it's my literature. I know it because we give it practically, but definitely I have read it somewhere, so you can just check it. But
so how to give atropine, injectable or a patch?
Yeah, it is. If patch is available, that's really good enough. But we used to give it injectable because there is no oral or patch available in Pakistan.